Welcome to Section 4. In this section, we will be discussing primary emergency life support. Choking or blocked airways. Choking adults. Sometimes food can obstruct the airway of a person while talking when he or she is eating. Common symptoms. When this happens, a person will clutch his or her throat with both hands. He or she is making the universal sign for choking. If the person can cough or talk, encourage him or her to continue coughing. But once the patient can no longer talk or cough, you must clear the obstructed airway. Children and infants start to cry, and a color change to blue appears. Treatment. To clear the obstructed airway that causes choking, you must perform abdominal thrust by doing the following. Ask, "Are you choking?" The person will indicate that he or she is choking. If the person can talk, breathe, or cough, just encourage coughing. When the person cannot cough and is still choking, do the following. Stand or kneel behind the person and grab your fist just above the person's navel. Perform up to 5 rapid inward and upward abdominal thrusts. Repeat abdominal thrusts until the object is dislodged or the person becomes unconscious. If the person is markedly obese or in late pregnancy, do up to 5 rapid chest thrusts instead of abdominal thrusts. Repeat chest thrusts until the object is dislodged or the person becomes unconscious. If the person becomes unconscious, start CPR. If you see an object in the mouth, carefully remove it with a finger sweep. Choking children. If the child can cough or talk, encourage him or her to continue coughing. If the child cannot cough or talk, ask if he or she is choking. Perform abdominal thrusts. Stand behind the patient, wrap your arms around his or her waist, and make a fist with one hand. Place the thumb side of the fist against the child's abdomen, above the belly button yet far below the tip of the breastbone. Put your other hand over the fist, and give 5 quick upward thrusts into the patient's abdomen. Follow up with 5 back slaps. Continue giving thrusts until the airway is cleared and the child begins to breathe, or until the child becomes unconscious. If the child becomes unconscious, start CPR. Choking infant. Give 5 back blows and 5 chest thrusts. Place the infant face up on your forearm. Put your other arm on top of the infant. Use your thumb and fingers to hold the infant's jaw, sandwiching the infant between your forearms. Turn the infant over, face down on your forearm. Place your arm down on your thigh, being sure that the infant's head is lower than his or her chest. Using the heel of your hand, give 5 back blows between the infant's shoulder blades. Be sure to hold the infant's jaw with your thumb and fingers to stabilize his or her head. You must turn the infant back over to give chest thrusts. Place your free hand and forearm across the infant, sandwiching it between your forearms and supporting his or her head. Turn the infant over onto his or her back and place your arm down on your thigh, making sure the infant's head is lower than his or her chest. Imagine a line across the infant's chest between the nipples. Place your ring finger on the infant's breastbone just below the imaginary line. Place the pads of the next 2 fingers just under the line. Raise your ring finger, and if you can feel the notch at the tip of the infant's breastbone, move your fingers up a little bit. Compress the infant's breastbone 4 cm with the pads of your fingers and then let the breastbone return to its normal position. Give 5 compressions. Continue giving back blows and chest thrusts until the infant can breathe or cough. If the infant becomes unconscious, begin with CPR immediately.
I'm now going to demonstrate how we do choking on an infant. This is how we support the head. Put the baby head down and give 5 back slaps. 1, 2, 3, 4, 5. Turn baby around, always supporting the head. Check inside the mouth, nothing inside the mouth. Give 5 chest thrusts exactly there where you will do CPR. 1, 2, 3, 4, 5. Check inside the mouth, nothing inside the mouth. 1, 2, 3, 4, 5. Turn baby around, check inside the mouth, nothing. 1, 2, 3, 4, 5. If I do see something in the mouth, put baby in a recovery position and we finger sweep it out.
Rescue breathing or artificial resuscitation. A person can stop breathing for many reasons, for example, sudden illness, allergy, and a serious accident. When a person is not breathing, but still has a pulse, it is crucial that you perform rescue breathing, which in effect is breathing for the unconscious person. When a person stops breathing, there is only a few minutes that pass before brain damage and death occurs. In a child, this time frame is even shorter. In fact, it is recommended that you give an unconscious, not breathing child rescue breaths for a minute, before you even call emergency services. Only stop giving rescue breaths if the patient begins to breathe on his or her own. The patient has no pulse. Begin CPR immediately. More advanced medical personnel take over. You are too exhausted to continue. Rescue breathing is the act of breathing for a person who is not breathing yet has a pulse. You should never perform rescue breathing on a stranger, unless you have a barrier device, so that you will not catch any contagious disease the patient is carrying. Should an adult, child or infant's pulse return but is not breathing effectively, assist with rescue breaths. Rescue breaths are given to adults by delivering one breath every 6 seconds, children, and infants by delivering one breath every 2 to 3 seconds. Assessing the patient. Without moving the injured, the first aider places his hands on the patient's chest to feel for breathing and looks at the patient's chest for chest movement. This is done for not less than 10 seconds. Positioning the patient. If the patient is crumpled up, or lying face down, he is not able to be treated or helped. You must position him on his back, on a hard surface. You must exercise great care in turning him over, as he might have broken bones or other injuries. For example, spinal injuries. Head tilt and chin lift. Place one hand on the forehead of the patient, and 2 fingers of the other hand under the chin. Tilt the head backwards, and lift the chin at the same time, thus opening the airway. Jaw thrust. The jaw thrust technique is the safest approach to opening the airway of a victim who has a suspected neck injury. This can be accomplished by the rescuer grasping the angles of the victim's lower jaw and lifting with both hands, one on each side, displacing the mandible forward while tilting the head backwards. The rescuer's elbows should rest on the surface on which the victim is lying. If the lips close, the lower lip can be retracted with the thumb. If mouth-to-mouth breathing is necessary, close the nostrils by placing your cheek tightly against them. The head can be carefully supported without tilting it backwards, or turning it from side to side. Breathing difficulty or breathlessness. Breathing difficulty involves a sensation of difficult, or uncomfortable breathing, or a feeling of not getting enough air. Wheezing is one form of breathing difficulty. Shortness of breath or breathing difficulty has many different causes, including a blockage in the airway, medical conditions, as well as high altitudes, to name a few. In some circumstances, a small degree of breathing difficulty may be normal. Severe nasal congestion and being unfit are 2 examples. If difficulty breathing is new, or is getting worse, this may indicate a serious problem. Though many causes are harmless and easily corrected, any breathing difficulty requires that you contact your healthcare provider. Breathing difficulties can be described in several different ways. You may be short of breath, unable to take a deep breath, gasping for air, or feel like you are not getting enough air. If you are having difficulty breathing, it is almost always a medical emergency, other than feeling slightly winded from normal activity like exercise or climbing a hill. Signs and symptoms of breathlessness. Bluish lips, fingers, and fingernails. Chest moving in an unusual way as the person breathes, this may indicate an airway or chest injury. Chest pain, which could be a heart attack or injury. Sharp chest pain could be pulmonary embolism or collapsed lung. Confusion, lightheadedness, weakness, or sleepiness. Cough, if the person also has phlegm or sputum, this may be pneumonia. A barking cough in a child is croup. Fever. And gurgling, wheezing, or whistling sounds. First aid treatment for breathlessness. Call the emergency services. Check the person's airway, breathing, and circulation. If necessary, begin CPR and first aid for bleeding. Loosen any tight clothing. Help the person use any prescribed medication, such as an asthma inhaler or home oxygen. Continue to monitor the person's breathing and circulation until medical help arrives. Do not assume that the person's condition is improving if you can no longer hear wheezing. If there are open wounds in the neck or chest, they must be closed immediately, especially if air bubbles appear in the wound. Bandage such wounds at once. A sucking chest wound allows air to enter the person's chest cavity with each breath. This can cause a collapsed lung. Bandage the wound with plastic wrap, a plastic bag, or gauze pads covered with petroleum jelly, sealing it except for one corner. This allows trapped air to escape from the chest but prevents air from entering the chest through the wound. Do nots. Do not give the person any foods or drinks. Do not move the person if there has been a chest or airway injury unless it is absolutely necessary. Do not place a pillow under the person's head if he or she is lying down. This can close the airway. Do not wait to see if the person's condition improves before getting medical help. Get help immediately. The EpiPen. Everybody with severe allergy should be aware of the possibility of a potentially life-threatening reaction that impairs breathing, causing a sudden drop in blood pressure, and can send a body into shock. For that reason, most people with severe allergies are prescribed epinephrine, also known as adrenaline, administered with an auto-injector as soon as symptoms develop. In South Africa it is available as an EpiPen. The EpiPen must be given as soon as you see that the patient has breathing problems due to an allergic reaction. Only the patient's own EpiPen must be given. If no EpiPen is available, call the ambulance services immediately, or get the patient to a hospital immediately. Most people that experience breathing problems due to allergic reactions should carry an EpiPen with them. Objectives of resuscitation. The human brain requires a constant supply of oxygen to work efficiently. A person who has stopped breathing will start to suffer irreversible brain damage within 4 to 6 minutes. The first aider has this in mind, and is aiming to provide basic life support to the casualty by administering an adequate supply of oxygen to the casualty, and supporting circulation until signs of life return. The first aider will wait until professional medical assistance arrives, who can take over the treatment. Cardiopulmonary resuscitation is known as CPR. This procedure is applied to a person who has stopped breathing and whose heart has stopped beating. CPR is a combination of rescue breathing and artificial circulation, created by external chest compressions. The rescue breathing provides oxygen to the lungs, and artificial circulation, which causes blood to flow from the heart to the lungs where it picks up oxygen, to be carried to vital organs sustaining life. All the cells in your body require oxygen to survive. They also require a good supply of nutrients and the rapid removal of waste products. Oxygen and nutrients are carried around the body in your blood, which is pumped by your heart. In your lungs, oxygen enters your bloodstream, and carbon dioxide, a waste product, is removed in a process known as gas exchange. A cardiac arrest is when your heart stops beating. This is not the same as a heart attack, although a heart attack may lead to a cardiac arrest. There are numerous causes of cardiac arrests, including a disturbance in the heart rhythm, drugs or poisoning, heart disease or a heart attack, traumatic injury or blood loss, and anaphylaxis, a severe allergic reaction. If a cardiac arrest occurs, blood will stop circulating around the body. Breathing will also cease as well, though it may not stop completely for several minutes. Without a supply of oxygen, the cells in the body start to die. Brain cells are incredibly sensitive. After about 4 to 6 minutes of no oxygen, brain cells will begin dying, leading to brain damage and death. The purpose of CPR is to keep oxygenated blood flowing around the body, to keep the vital organs alive. CPR itself could restart someone's heart, or keep the vital organs oxygenated until a defibrillator arrives. A defibrillator is a device which delivers an electrical shock to the heart, to reset it back to normal activity. Will the patient wake up? In some cases, the patient will wake up after effective CPR, but this is not always the case. By doing chest compressions, you are taking over the job of the patient's heart, which has stopped, by forcibly compressing it. In effect, you are acting as a life support machine for the person. In order for the heart to resume normal activity, it may require an electrical shock from a defibrillator, or drugs given by a paramedic or doctor. CPR combined with electrical shock increases the chance of survival during cardiac arrest. Do I need to remove clothing? CPR is best performed when the chest is exposed. It is easier to see where you must place your hands when clothing is removed from the chest. Start CPR immediately when the patient does not have a pulse, and no breathing is present, or became unconscious after choking. Remove all clothing quickly from the chest when starting CPR. If a person's clothes are difficult to remove, you can still provide compressions over clothing, but make sure that all bulky clothing is removed. Compressions are ineffective when provided over thick jackets and other bulky clothes. CPR motions are modified for use on children and infants and are defined as follows. Adults, puberty and older. Children, 1 year to puberty. Infants, less than 1 year old. CPR procedure for adults and children. 1. First aider, compressions and ventilation. Alert the emergency medical services immediately and start with CPR. The patient must be on a solid hard surface. If the patient is not on a solid hard surface, move the patient onto a solid hard surface. Interlock your hands and place them in the middle of the person's chest, over the sternum or breastbone. 2 hands for adults, and 1 hand for children. The first aider's arms must be straight, and the shoulders directly above the chest of the patient. Begin CPR cycle. Compressions at a rate of 100 to 120 per minute, for a total of 30 compressions. Counting at a constant speed, for example, 1 end, 2 end, 3 end, 4 end, 5 etc. to 30. This will help maintain rhythm, rate, and count. 2 artificial respirations must be given in 10 seconds. Perform 5 full cycles of 30 compressions and 2 ventilations, which should take about 2 minutes. Check breathing and pulse after every 5th cycle of CPR. CPR must be given until the patient starts breathing. The patient has a pulse but is not breathing. Rescue breathing must be administered with 1 breath every 6 seconds. More qualified help arrives. It becomes too dangerous for the first aider to continue. The first aider is too tired to carry on with CPR. A doctor or paramedic tells you to stop. 2 first aiders, compressions, and ventilations. When 2 first aiders are present, 1 first aider should start the assessment of the patient, and the second rescuer should alert the emergency medical services immediately, and start with CPR. The patient must be on a solid hard surface. If the patient is not on a solid hard surface, move the patient onto a solid hard surface. The pulse and breathing are checked. When no pulse and breathing are found, CPR is started immediately. When the second rescuer returns, compressors are alternated after every 5 cycles of 30 compressions and 2 ventilations. Children and infants. Only 15 compressions, with 2 ventilations are given, but the number of cycles increased to 10. 2 minutes of CPR before the pulse and breathing are checked again.
I arrive at the scene, I check my hazards, I ask what happened, when did it happen, how did it happen. I come down to my patient. Hello, hello. Hello, hello. No response. Bystander, can you please phone 112 for me? Tell them I've got an unresponsive adult male. Give them the location and report back to me. Do you understand?
Yes, I do.
If you can, also bring me a first aid kit and an AED if available.
I will.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bystander, please phone them back. Tell them I'm starting with CPR. One, 2, 3, 4, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 22, 23, 24, 25, 26, 27, 28, 29, 30. We're carrying on, no equipment.
No, can I help you?
Yes, please. 9, 10, 11, 12, 13, 14, 16, 17, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12,
Apply
13,
pads
14,
to
15,
patient's bare chest.
17, 18,
Plug in
19,
pads
20,
connector
21,
next to
22,
flashing
23,
light.
24, 25, 27, 28, 29,
Apply
30.
pad analyzing
2, 3,
heart
4,
rhythm.
5, 6, 7, 8,
Do
9,
not
10.
touch the patient.
You clear, I'm clear, we clear.
Shock advised. Charging. Stay clear of patient.
You clear, I'm clear, we clear.
Deliver shock now. Press the orange button. Shock delivered. Begin CPR. Starting with chest compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
Analyzing
17.
heart rhythm. Do not touch the patient. No shock advised. Begin CPR, starting with chest compressions.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Very good. Very good. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Very good. Very good. 1, 2, 3, 4, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. Very good. Very good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Analyzing heart rhythm. Do not touch the patient.
Arrive at the scene, I check my safety. Any hazards, I ask what happened, when did it happen, how did it happen. Approach my patient. Hello, hello. Hello, hello. No response. Bystander, can you please phone 112 for me? Tell them I've got an unresponsive child, give them the location and report back to me. Do you understand?
Yes,
If you can, also bring me a first aid kit and an AED if available.
will do.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bystander, please phone them back. Tell them I'm starting with CPR. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Your equipment available? I'm carrying on.
No, I'm also first aider. Can I help you?
6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
1, 2,
Plug in pads connector next flashing light.
9, 10, 12,
Do
13,
not touch the
14.
patient.
I'm clear, you clear, all clear?
Shock advised.
I'm clear, you clear, all clear?
Charging. Stay clear of patient.
I'm clear, you clear, all clear?
Deliver shock now. Press the orange button now. Shock delivered. Begin CPR. Starting with chest compressions.
Remember 15 compressions?
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5.
Analyzing heart rhythm. Do not touch the patient.
I'm clear, you clear, all
No
clear?
shock advised. Begin CPR. Starting with chest compressions.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13,
Analyzing
14.
CPR procedure for infants. Compressions and ventilations. Alert the emergency medical services immediately. And start with CPR. Position the infant. Turn the infant on his back on a firm, flat surface, supporting the head and neck during the move. The pulse is then checked at the brachial artery, with 2 fingertips, and feels for signs of a pulse. If unsure, look for any signs of life. Landmark to position, 2 fingertips along the length of the sternum, 1 finger's width below the line between the infant's nipples. Compress the chest vertically, to a depth of 4 cm. Release the pressure, to allow the chest to return to its normal shape, but keep the fingers in place. Pressure and release should be of equal time, and take less than 1 second. Give 30 compressions at a rate of 100 to 120 per minute. Counting at a constant speed, for example 1 and 2 and 3. This will help maintain rhythm and the correct rate. If you are unable to achieve the guideline recommended depth, at least 1/3 the diameter of the chest, you can use the heel of one hand, taking precaution not to compress too hard. Open the airway, and give 2 ventilations. Complete 30 compressions, and 2 ventilations for 5 cycles. Reassess the infant after every 5th cycle.
Checking for hazard. Making sure everything is clear. Hello, hello. Hello, hello. Bystander, please call 112. Tell them we have an unresponsive infant. Please tell them to bring first aid kit and AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bystander, please tell them that I'm going to continue doing CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I don't have any equipment, but I'll continue. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, please.
No AED available.
20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
4,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
5,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
6,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
7,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
8,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15.
9,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 1, 2,
Last cycle.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No pulse, no breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 3, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 5, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 6, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 7, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 8, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. Last cycle, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9.
AED. AEDs are sophisticated machines designed to deliver electrical shocks to victims of cardiac arrest. They are fully automated and require little user input. Therefore, many AEDs are designed to be used by bystanders with limited formal training. AEDs are often found in many public places and in many institutions, including government buildings, schools, colleges, universities, and major shops. They are also found on public transport. AEDs in public places may be called public access defibrillators. What is defibrillation? The heart is a muscle which is controlled by electrical activity. Normally, this electrical activity keeps the heart pumping in a coordinated way. This coordinated electrical activity allows the heart to pump blood around our body. The heart can sometimes go into an abnormal rhythm, where all the electrical activity is disorganized and random. When this happens, the heart is no longer able to pump blood around the body. The funny rhythm is caused by disorganized electrical activity, and the pumping action of the heart no longer works. The person will stop breathing, and this is a cardiac arrest. So how does defibrillation help? A defibrillator is a device which delivers an electrical shock to the heart to stop all this disorganized electrical activity. This gives the heart a chance to start in a normal rhythm again. An AED is an automated external defibrillator. A defibrillator which can be used by anyone with limited medical training, as everything is fully automated. An AED will analyze the heart rhythm in a patient. If appropriate, it will then deliver a controlled electrical shock to the patient. AED components. In general, AEDs have the following features and equipment. The main AED unit. The main unit contains the AED's sophisticated computer and battery pack. On some models there will be an on or off button. Other models will turn on automatically when you open the unit, for example the model shown in the picture. The AED unit is connected to the chest pads via a lead. This lead can be unplugged to change the pads if required. There may be a shock button to deliver an electrical shock. However, be advised some models are fully automated and will shock whenever they are ready to. There may also be a speaker, battery life indicator, and written instructions on the main unit. Pads and leads. The AED delivers an electrical shock to a patient via 2 chest pads. These pads are plugged into the unit. Each pad is covered in a strong adhesive, allowing it to be stuck to the patient's bare chest. AEDs should contain at least 1 set of spare pads. You may find both adult and pediatric pads in some models. Accessory equipment. An AED may contain other items including small towel. This is used to dry the chest of the patient before applying pads. Razor. Excessive chest hair may prevent the pads sticking, so a razor is provided. Scissors. Pads should be applied to bare skin, so scissors may be provided to cut through clothing. Safety considerations. AEDs are very safe devices. However, there are a number of safety aspects to consider when using an AED. Water. Water and electricity do not mix. A towel should be provided along with an AED. This is to dry the patient's chest. Electricity will take the path of least resistance, so if there is water on the chest, then the shock will travel through the water instead of the heart muscle. Direct contact. No one should touch the patient during delivery of the electrical shock by an AED. The AED will instruct everyone to stand clear. As the operator, you should repeat this command and ensure everyone is clear of the patient. Explosive environment. An AED is delivering an electrical shock. Therefore, there is always the risk of a spark. You should not use an AED in an explosive environment where there is a buildup of flammable vapors. One example would be a gas or petrol station forecourt. Another consideration is the use of oxygen by emergency medical staff. If oxygen is being used, it should be at least 1 meter away from the AED, and consideration should be given to the possibility of oxygen building up in the atmosphere. Chest hair. The chest pads should be applied to bare skin. Excessive chest hair can disrupt the contact of the pads with the skin and result in burns when the electrical shock is applied. A razor is supplied so you can shave excessive chest hair. Once again, do not spend a long time on this. Shaving cuts rash is the least of your patient's worries. Using an AED. Using an AED is easy. It is fully automated. The machine will also give voice prompts to guide you. Remember to consider all the safety aspects discussed previously. For example, ensure the chest is dry before applying the pads. It is important to ensure the chest pads are positioned correctly. They are very sticky due to the strong adhesive. Take care to get the position right the first time. AED procedure. If alone, connect the AED before starting CPR. If in a group, one person can start CPR, once another sets up the AED. Once the AED is connected, it will analyze the heart rhythm. The AED will either decide to deliver a shock, or instruct you to continue CPR for 2 minutes. Shock. Ensure everyone is clear of the patient before delivering the shock. A loud verbal command of stand clear is suggested. Continue CPR. Immediately begin CPR on the patient. The AED will continue in this cycle of analyzing, and then deciding to shock or continue CPR.
I arrive at the scene, I check my hazards. I ask what happened, when did it happen, how did it happen. I come down to my patient. Hello, hello. Hello, hello. No response. Bystander, can you please phone 112 for me? Tell them I've got an unresponsive adult male. Give them the location and report back to me. Do you understand?
Yes, I do.
If you can, also bring me a first aid kit and an AED if available.
I will.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bystander, please phone them back. Tell them I'm starting with CPR. 1, 2, 3, 4, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 22, 23, 24, 25, 26, 27, 28, 29, 30. We're carrying on, no equipment.
No, can I help you?
Yes, please. 9, 10, 11, 12, 13, 14, 15, 16, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12,
Apply
13,
pads
14,
to
15,
patient's bare chest.
17, 18,
Plug in
19,
pads
20,
connector
21,
next to
22,
flashing
23,
light.
24, 25, 27, 28, 29,
Apply
30.
pad analyzing
2, 3,
heart
4,
rhythm.
5, 6, 7, 8,
Do
9,
not
10.
touch the patient.
You clear, I'm clear, we clear.
Shock advised. Charging. Stay clear of patient.
You clear, I'm clear, we clear.
Deliver shock now. Press the orange button. Shock delivered. Begin CPR. Starting with chest compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
Analyzing
17.
heart rhythm. Do not touch the patient. No shock advised. Begin CPR, starting with chest compressions.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Very good. Very good. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Very good. Very good. 1, 2, 3, 4, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Very good. Very good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Analyzing heart rhythm. Do not touch the patient.
When we do CPR, if there is no pulse or no breathing or no signs of life, we carry on with CPR. Follow the instructions of the AED. If the person does have a pulse and is not breathing, we give 1 breath every 5 seconds. If the patient shows signs of life or there is a pulse and breathing present, we place the patient in recovery position. Arrive at the scene and check my safety. Any hazards, I ask what happened, when did it happen, how did it happen. Approach my patient. Hello, hello. Hello, hello. No response. Bystander, can you please phone 112 for me? Tell them I've got an unresponsive child, give them the location and report back to me. Do you understand?
Yes,
If you can, also bring me a first aid kit and an AED if available.
will do.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bystander, please phone them back. Tell them I'm starting with CPR. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30. No equipment available. I'm carrying on.
No, I'm also first aid. Can I help you?
6, 7, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. pads connector next to flashing light.
9, 10, 12,
Do
13,
not touch
14.
the patient.
I'm clear, you clear, all clear?
Shock advised.
I'm clear, you clear, all clear?
Charging. Stay clear of patient.
I'm clear, you clear, all clear?
Deliver shock now. Press the orange button now. Shock delivered. Begin CPR. Starting with chest compressions.
Remember 15 compressions?
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5.
Analyzing heart rhythm. Do not touch the patient.
I'm clear, you clear, all
No
clear?
shock advised. Begin CPR. Starting with chest compressions.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.